Nedra.
Thank you, Rich. Hello again to many of you, and welcome to the journalists who have joined us for this panel. Very briefly, I'm with the Entertainment Industries Council, and we're providing assistance and resources to journalists and to the entertainment industry around how to depict mental health issues effectively and in a way that's not going to perpetuate stigma and discrimination and stereotypes. So I'm going to be talking a little bit about some research that we did that's similar to what Inara did, but looking more generally at mental health and how mental health is covered in California newspapers. And I'm also going to be providing you with our best practice recommendations that we've come up with for journalists to help them when they're reporting a story that has a mental health angle, how to do so effectively. So just as broad context, about 1 in 5 Californians have a mental health issue at any given time, and 1 in 4 over the course of their lifetimes. And this is not just in California, this is pretty much across the board. So mental health issues are something that affect all of us. If it's not us that has the mental illness, it may be someone we know and love. And so it's something that is important for reporters to be aware of as they're reporting how that may be influencing a lot of people in their world. Very briefly, there was a study that was done by Field Research Corporation as part of this CalMHSA program initiative that found that stigma around mental illness is very much alive and well in California. People still have a lot of misconceptions and stereotypes that can lead to discrimination against people with mental illness. And this can also lead to individuals who are experiencing mental health issues not wanting to tell anybody or not wanting to seek treatment because they're afraid of what may happen if they do. So this is what we're trying to work through the media to address. And media really matters in this. Media makes a big difference in how people think about mental illness and people with mental illness. Media is part of the ecosystem around us that influences our attitudes and our behaviors. So when people who have a mental illness are constantly portrayed as being dangerous or unstable through news or entertainment portrayals, when the vast majority of people who have a mental illness are not violent, that perpetuates stereotypes. And researchers have found that in addressing stigma and trying to reduce that, the thing that's most effective is personal contact with people with a person who has mental illness. And it doesn't have to be someone in real life. It can be through stories in entertainment media on their favorite show. Maybe a character is undergoing mental illness, or it can be through news stories as well. So very briefly, we did a study looking at newspapers in California to try to get an idea of what is the current state of reporting on mental health, looking primarily at newspapers, both in English and Spanish. And we wanted to be able to get kind of a baseline so that we knew what kinds of resources did we need to be providing, who did we need to be reaching out to. And so what we did is sampled 10 English and 12 Spanish newspapers of different sizes throughout the state. We did a keyword search, both in the English terms and Spanish terms, for the words anxiety, mental health, mental illness, mentally ill, schizophrenia, and schizophrenic. And we found that those terms covered most of the coverage that's out there in terms of things that touch on mental health issues. Now, I'm not going to go into all of the results because I want to spend more time on our best practices recommendations, but we do have a report that we can share with you on that. But generally what the results are that we found is that mental health reporting is a mixed bag. There are bright spots where we found that the English language reporting around particular issues, actually a majority of the articles we looked at talked about things like prevention, treatment, places to get help. But we also found that there are areas of improvement that are needed, and found especially that in the Spanish language newspapers, there was a lot less discussion of the more positive aspects, and in particular including things like sources of help. But what we found through a lot of our work with Spanish language reporters is that they really want help. They really want these kinds of resources to be able to report accurately and to help their community. So we're really trying to work closely, especially with Univision and Julio as well. We're going to be tracking over time the results and hopefully see that these kinds of things are reported more often in the English and Spanish newspapers. We also found that while some negative reporting is unavoidable, there's always going to be news out there that has some kind of tie to someone who has a mental illness. What we really need is more positive articles, or at least articles that show a positive side, that show people seeking treatment, people in recovery, providing hope to people who may be reading those articles and seeing, well, if that person was able to get out of what was going on with them, maybe if I seek treatment, I'll have a good outcome as well. So we're really encouraging more balanced coverage so that it's not only negative reporting or negative stories that are being reported. So in terms of our best practices recommendations, what we've done is we, first of all, boiled it down to 3 key questions that we would like journalists to keep in mind as they're reporting a story to help them think through the implications and the issues that are relevant. And first I'll just list these questions and then we'll go into the specific recommendations. So first of all, think about whether mental health is relevant to the story. It may be that some kind of violent incident happened, but the mental health status of the individual who did that is not relevant to the story at all. So before bringing that mental health piece into the article or story, you want to make sure that it's actually relevant. You want to make sure that you have a reliable source for the subject's mental health diagnosis. Don't just make assumptions, or don't listen to what the neighbor happens to say about the person's mental health status. And third, thinking through what's the most accurate language that you can use to describe the situation and report on the story. So if you remember nothing else from my presentation, at least remember relevance, source, and language. These are the 3 pieces that are really key. And so now I'm going to go into more depth in our best practices recommendations, and I'll also let you know, if you have not already received a copy of our mental health reporting style guide, we created this style guide to be used alongside your AP style book for reference whenever your journalist is reporting on a story that may have a mental health component. It gives you the different elements to think about as you're reporting it. The term itself, mental illness, covers a lot of conditions, a wide range of different kinds of things. So when reporting a story, don't just say that someone has a mental illness. If you know the particular diagnosis, use that as what you're reporting, because otherwise it can kind of imply that all mental illnesses are generally the same, whereas it's very different from one to the next often. Next, avoid any kind of value-laden language, assuming that someone who has a mental illness is a victim or is suffering or is afflicted with the condition, because for a lot of people it's just part of their day-to-day lives. It's something they have to deal with, but it may not be something they feel like they're suffering from. So use value-neutral language, so saying that someone is living with schizophrenia or has been diagnosed with bipolar disorder, for example, rather than saying that they're suffering from schizophrenia. Next, try to use people-first language. And what this means is, instead of saying that someone is a schizophrenic or or, or using other labels like that, an anorexic, or is bipolar. Rather than using the word to represent the person, try to use people first language, which means she was diagnosed with bipolar disorder, he's living with schizophrenia, or even just that they have that condition, but it's not the condition that defines them. You also want to try to avoid any derogatory slang words. I'm sure none of you would do this, but we certainly have seen in certain articles that people have used language like he's psychotic, they've gone nuts, they're acting deranged. So avoiding those kinds of words can help reduce the stigma as well. Providing balance, like I said earlier, offering positive stories of hope and help and recovery is really important to help balance out the negative. As well as what Inara was just talking about, including information about local resources. And as I said in my workshops, all of you are those resources, many of you in this room. So reach out to your local journalists and offer yourself as a resource that they can draw on. And I'll just briefly acknowledge our project partners on this: Rheingold, the Hispanic Communications Network, Fisher Communications, and Chapman University. And for more information, you can reach me at this information. Thank you so much.